The Master of Teaching program, it's based on a clinical model and understanding of pre-service teacher education that's based on very close partnerships with schools. Koonung Secondary College has been a partner from very early in the development of the Master of Teaching.
We saw it as being an investment in our staff as well as the pre-service teachers.
One of the key characteristics of our clinical model of teacher education is that we have particular school-based staff called teaching fellows. We also have our clinical specialists. They work together to develop the program, and the program is very much based on this shared understanding of clinical in terms of we are all wanting to focus on student learning, and we're all very interested in how to enhance and improve student learning.
So my name's Jane Thornton. I'm the Teaching Fellow, 0.5 employed by the university and 0.5 by Koonung. My role involves placing the student teachers, which I call teacher candidates, with a mentor teacher. So I'll meet with them at the university and we'll have a 4-hour induction, and I'll also work with the partnership schools. So the partnership schools are the schools that obviously aren't Koonung. They're in the local area, and that's usually around 5 or 6 schools.
When we start off with a new cohort of students, all the mentor teachers and the teacher candidates come together. Because we're one of the base schools, we've got our teaching fellow Jane, and she hosts professional development at the start, enhance communication and develop relationships and things like that with the teacher candidates.
Also to induct the mentor teacher so they understand clinical practice and how to give non-judgmental evidence-based feedback.
This was my first placement, so it was great having a teaching fellow for the process, so she knew what we were juggling between uni and our placement. She also knew what was expected in terms of our placement, our assignments. She also marked lots of our assignments as well, so could provide us with feedback and extensions if we needed.
So the Melbourne model of clinical teaching is really based on an understanding of the learner, that the learner is the focus and centre of all that we do.
So we're bringing the knowledge from the university to the base school. So the partnership schools, they all come to Koonung for a seminar. We run 4 per placement, along with a clinical specialist who's a university-based person. We'll run the seminar, and we will model hopefully best practice to the teacher candidates, and we'll show them different pedagogy.
So we've developed a framework that we call the clinical judgment for teaching, and the Melbourne approach to that, and it consists of a series of questions that underpin the entire program. So the first question is, what is the learner ready to learn, and what evidence supports this? Our second question is, what are the possible evidence-based research interventions that you might want to undertake to support this learner and their learning? Then we ask, what teaching strategies, how are you going to do this? What teaching strategies are preferred, and how do you know that these are the best teaching strategies in this particular situation, in this particular context for this particular learner? Then we ask an important question about impact. What is the intended impact on learning?
So part of the University of Melbourne conditions are that they observe 40 hours of teaching and they teach 40 hours.
One of the powerful things that has happened is that our classrooms have opened up. All of our classrooms are open. Pre-service teachers are able to sign up and go and visit the classrooms of teachers other than their mentor.
And the way that we do that is we have an observation wall, so the photos of each of the teachers that that invite teacher candidates to observe them is on the wall. It says their subject and what conditions they place on it, whether they need 30 minutes or whatnot notice for the teacher candidate to observe them.
Because it is so important that a teacher candidate sees beyond what their mentor teacher does.
Now the last question in this cycle is really important because we ask our teacher candidates to reflect on what actually happened.
They're taught to use evidence.
We've got cameras, a supervising teacher can book a class into that space.
The mentor teachers provide the non-judgmental evidence-based feedback each lesson, so they need to give written feedback or digital feedback to the teacher candidate, and I will go in twice and observe.
So she actually had a tool on her iPad that she used. It actually showed on the iPad who we'd spoken to, so there was diagrams. It also had a checklist that she could go through as to whether, we'd done an entry task, whether we'd set a class objectives.
So they can see who they've missed. They don't need to be told, oh, this was good or that was bad. They can look at the feedback and make decisions based on the evidence and then change their practice.
It's really important for teacher candidates to develop a disposition at a way of looking at data, at seeing data and evidence as a key way in which they might support the decisions that they make.
There has been an effect, and I think it's been strong. Teachers are sharing, they're engaging with each other, and it has definitely made a difference to student outcomes in the school.